and all of that will require sanitation and protocols that will indeed be costly. And we need to supplement what our providers are getting in terms of their support and make sure that we are hitting that issue head on. Of course, data. And we can talk for hours and hours about large-scale procurement of IT in the state, and we are turning the page. Some of those efforts, we have a lot more to say on that topic in the next months and certainly next year's budget. The issue of IT and data management is critical. And I'll just end on this and pass it over to Dr. Galley, because I think it's important, because it's always been a stubborn point of concern as it relates to anything we do at scale and our ability for existing systems to manage at the scale of a pandemic. I'll remind you that there are two IT strategies. You have the interface with the public, which is our current California Immunization Registry. It's an existing platform called the CARE system that's already in place. It's a relatively good system, but it's not good enough, we believe, to address all of the needs in the state. And that's why we have been going through an advanced procurement process. We're looking as early as the next 10 days to get the finalists signed off to do an end-to-end IT strategy. That's why you see in this slide 2 phases of IT development, both December, as early as December 1st, and January. But also, it's critical that we lock in with our providers, and that's the clinics and the hospitals, et cetera, the distribution that eventually will be out into many of the pharmacies in the state, that we have provider registration, reporting, tracking, ordering. All of that needs to feed into our state system, and not just that direct interface with users through the CARE system. So all of that we've been working on. All of that is nearing critical decision-making in the next few weeks and in the next few months. So that's an update on where we are on vaccinations. We are making real progress. I'm very proud of the teams that we have pre-assembled. We're not reacting to this moment. We've leaned into it. We've been proactive. And closing, before I turn over to Dr. Galley, we also are blessed to be supported by the new COVID Advisory Committee that Vice President now President elect Joe Biden has organized, that includes, by the way, one of our Scientific Safety Review Committee members that the President-elect took to be part of the National Advisory Committee. This, in addition to those other Californians that are also on that National Advisory Committee. So we're very blessed to have strong relationships with the current administration vis-a-vis this vaccination strategy, and even stronger still with the incoming administration. But with that, I want to now turn it over to Dr. Galley and talk about incoming, and that is the number of inquiries that he has received around gatherings for Thanksgiving, and the likelihood that we will see an increase in spread of transmissions as we see more and more mixing, and what we are doing to prepare for that. Some of the messaging that we predates today on the travel advisories and some of the issues related to that 10 to 5 a.m. non-essential activities that will lead into being more safe and working our way through this holiday season. With that, Dr. Galley.
Great. Thank you, Governor, and thank you all for tuning in. Governor, you, as always, did a tremendous job explaining where we are on what is a really hopeful topic, which is vaccinations. California is preparing, has been preparing, and is ready to work with our local partners, our federal partners, to make sure that vaccines, which are really weeks away for some populations, are ready, and that we use it as the important tool that they are. But now, more than ever, with that hopeful news, it's important that we keep our guard up and we keep doing the things that we've been talking about over the last many months. It's not that there's a promise that everyone will get the vaccine in the first few months of the year, but some of our most vulnerable individuals, those who are working on the front lines of our hospitals that are exposed almost every day to COVID-19, will be protected. That's great news for our communities. And it tells me and tells us that the dependence on continuing to keep our guard up like we can make it. We can do this as a state, and we've done it before, and we need to continue doing that. And with this Thanksgiving holiday coming up, it's an important week to emphasize all of those protective factors. And the governor mentioned on an earlier slide that just 60% of our cases are, or a full 60% of our cases are among those 19 to 49 years old. So a vast majority of the cases or those who we test who are infected are in that age category, yet they make up only 7% of those who have the worst outcome in death in this state. So let me say that again, 60% of cases, yet only 70% of our deaths. The real story in that is, where are all the deaths happening? And that is because although it's only 10% of our cases for those over the age of 65, full 75% of California's deaths have been in that older age group. So what does it mean for our traditional Thanksgiving celebrations or celebrations in the many weeks to come, when we bring together many generations for traditions and celebration and a great time together, that those younger individuals who many are not sick or not very sick, not sick at all, they're the asymptomatic or pre-symptomatic individuals, folks who will never need to go into an urgent care center, an emergency room, or be admitted, that they are exactly the individuals. We are the individuals who can spread COVID-19 to our older family members, our older friends, our own older loved ones. And in that risk, we need to just be very careful. We know that our hospitals already are seeing levels of surge that they've never seen before. Even at the height of our June and July peak of cases, we now have hospitals across the state that are telling us that their census, the number of people with COVID-19 in their hospitals, is higher than it's ever been. And we know that cases are still rising, and the overall average number of cases over a 7-day period is a lot higher than what it used to be. So what that means is we need to do our part. We need to help stop the spread and recognize that the days to come are really important, what our decisions are. I've had countless conversations with friends and family, but a lot of Californians who've reached out and said, we've decided to change what our Thanksgiving meal looks like. Instead of doing it later in the day, we're going to move it up. We're going to try to move it outside to catch a little bit of the warmer weather. Thankfully, it looks like we'll have some sun on that day. That there are some options, even at this day, just a few days ahead, to change that plan and maybe do something slightly differently. So we know that this is all part of stopping the spread, doing our part, and hopefully helping get California through the next many weeks as we anticipate parts of our communities getting the vaccine. Next slide. So the clearest guidance is celebrate with your own household. There's lots of ways to connect with those that you love. I know that we're going to be Zooming with loved ones, my mom in particular, a lot of the day on Thursday. Traditionally, she'd come and visit us and be with our family, but we're going to keep it safe and Zoom and interact with her that way. Of course, we know that some people are not able to prepare a meal, and maybe that's the urge to gather with them. But there's other ways to support those individuals to make that connection, dropping off a meal and then sharing it when you Zoom together. These are all options that give us opportunities to lower our risk, lower the risk of others, but hopefully still have that important connection that we all look forward to during these upcoming holidays. So as we end every time, and before I kick it back over to the governor and open it up for questions, just remind you of these 4 basic things. And, even as I put it up, I really want to push forward this idea that, yeah, you've heard wear the mask, and many of you are tired of wearing it, but we ask you as much as you can to keep it on. We put out the guidance, we let you know how and where to use your mask, but it's really a choice that each of us has to make, and not just make in the morning and, but something we have to make throughout the day. physically distance. That's an important thing, hard to do when we're keeping our distance from loved ones, but all the more important now, washing our hands and minimizing the mixing. And this really comes back to, in the days to come, keeping it with our households and reaching out to loved ones in a different way than we normally do. So with that, look forward to the questions, and Governor, back to you.
Great, thank you. Thank you. Of course, now we're happy to take any questions.
As the messenger has been compromised some since we last saw
I'm assuming the silence means we're having a bit of technical difficulties, and so look forward to figuring that out. Dr. Galley, just because the awkward silence, maybe I'll just ask you as we figure out the calls, question about the issue of travel advisory, what that means vis-a-vis Thanksgiving. Obviously, so much of the national attention has been focused on airports and people traveling all across this country, coming back into the state of California after traveling in other parts of the country. Perhaps you can give us a sense of what your reason we put out that advisory and your concerns in that space.
Yeah, thanks, Governor. And like many other parts of the nation, we're concerned about people traveling during the holiday season, that they go and they're in an environment maybe where transmission rates are much, much higher. Much of the country's experiencing higher rates of transmission than California, and visiting even just a few friends, keeping it short and coming back. Just those travels expose you to a level of COVID-19 that as you come back into the state, we're really encouraging you to do what you're doing, Governor, which is quarantine. Make sure that you weren't infected, that you don't end up inadvertently passing it on to other members of your community, and we can keep the spread low. So we know that even across the state, we're asking you to keep as local as you can. Don't travel beyond just a few hours from your home, so that you can also keep the spread down in our state. And that isn't an unusual thing. A lot of states have pushed travel advisories, travel restrictions, and we're among those, and have done it with our partners around the West Coast to make sure that we all keep ourselves protected, keep transmission as low as possible. And it makes a key difference. That 14 days that people recommend, a lot of folks are looking at that closely, making sure that it's the right amount of time. And for now, that's what we understand to be the incubation period, the time by which somebody might be exposed and by the time they're no longer infectious. And so that's why we have that 14-day number as well, Governor.
Doctor, last week, in sort of anticipating your questions, we figured this out. You announced on Friday this non-essential recommendation, people past 10 p.m. to 5 a.m. for non-essential activities. And on Monday, basically implied that we were not only looking at it, but that we were looking at the studies, the efficacy of these efforts around the world. And I think referred to 3 specific studies last Monday that we had reviewed, that you had provided, your team had reviewed, et cetera. The work that was done in Virginia relating to alcohol consumption, Massachusetts, other parts of the country that have limited versions, including many cities, not just states. Maybe you can give folks that may not have tuned in Friday an overview of what the thinking was in terms of that recommendation and why you think it's important at this stage.
Sure. I think, 2 very important ones. One is really we want to continue to communicate and provide information to all of Californians that where we are right now is different than where we were before. We're in a point of surge that we have to take out all of the tools in our toolbox and apply them here. And it is in part a symbol and a message to all of our public that what we're facing, every little bit matters. And I was asked, why is it the 10 to 5 that's special? One reporter said, can COVID tell time? And I said, candidly, no, of course. There's no reason why between 10 and 5 a.m., doing the exact same things done at 10 in the morning, that COVID will behave any differently. But what we do know, and what you alluded to, is that oftentimes during that time period, non-essential gatherings, non-essential coming together really does happen without the best protective tools. People take off their masks, they come a little closer than they should, they celebrate and do certain things that allow transmission to go pretty quickly. I say that COVID goes from 0 to 60 in no time, and that happens when all those protective factors are down. So, this is a tool for us across California and our purple counties that are facing the worst of our surge, to be additive with all the other tools that we have. And we hope, and we're looking closely at our data to see if that begins to turn the tide on these impressive case numbers, and hopefully in time to keep our hospitals in good shape so we can continue to provide care to those who need it and who are sick.
And before we open up to questions, and it looks like we finally figured that out, I just want to ask you one additional question in anticipation. This question has been brought up a number of times, and we made the point last week that we were putting this emergency brake on as it relates to our tiered status, rather than waiting till traditional Tuesday announcement, your Tuesday at noon announcement on new tiers. We moved on Monday. We made the point that we will in real time continue and assess if we were going to move tiers based upon the epidemiology, based upon the spread. On Friday, there was a review. You made the determination that we were not moving forward. Just preview a little bit. Tomorrow, you will be making announcements, updating based upon the data that you're getting this weekend. Maybe you can just preview a little bit about what you expect to be saying tomorrow.
Yeah, so thanks, Governor. Yes, just to reiterate, we did, as you promised, looked at the data at the end of last week and ran it like we do every week, and indeed no additional counties made tier movements, so we didn't. And we agreed that if a county needed to move, we would move them quickly so that we could begin to stem the tide on the surge in those areas. Tomorrow, we anticipate that there will be some tier movement, handful of counties likely moving to a more restrictive tier, and maybe even a county or two that are showing that they are getting containment on the virus and potentially meeting that 1 week mark to move forward. So again, a mixed picture across California. We are always looking at the data, trying to be as current as we can, and we report it as such, and we treat counties as such. You have said that California shouldn't be treated in the aggregate, that we have regions, we have counties, we have differences between the northern and the southern parts of our state, the inland and the coastal, and indeed that's what we see with all of these numbers. So tomorrow we will have an update on our tier status and more specifics tomorrow at noon.
Excellent. With that, we happy now answer any questions.
Sophia Balog, Sacramento Bee. Hi, Governor, can you hear me?
Perfectly.
Great. I'm going to go ahead and ask the question that my colleague Adam Beam of the AP tried to ask. We could hear him on the line, but it sounds like you couldn't. He wanted to know if you have lost credibility after photos have circulated of you at the birthday party earlier this month. You weren't wearing a mask in those photos, and yet you were talking very closely with other people. Can you speak to that and tell us what precautions you were taking at that party? You said you'd taken precautions, but it was not clear that that was happening from those photos.
Yeah, no, I made a mistake. I apologized. We had dinner, 4 o'clock dinner in an orange tiered county. We're not telling people they can't eat, but indeed, I made a mistake being with a few extra people beyond the guidelines that I've been promoting, which is outside the households. That was a mistake, and I let my guard down, and I apologize for it. And we're moving to correct that in terms of working hard, working harder every single day. Never made that mistake before. Haven't made it since, and I won't make it again. Period. Full stop.
Emily Hoven, Cal Matters. Hey, Governor. As you know, the State Controller Betty Eames has been saying for months that the Secretary of State's office doesn't have budgetary authority to pay for a $35 million contract awarded to SAD Knickerbocker. Do you think the Controller should approve payment of the contract, and do you think it was appropriate for the Secretary of State to award such a big contract to a firm involved in Joe Biden's presidential campaign?
I'll leave the Controller's perfectly situated. First of all, deep admiration for our Controller and her character, her competency, and her judgment. The Controller is reviewing that. She will make an independent assessment, and I look forward to that review and to her counsel. I will happily answer that question after I have the benefit of her review and independent analysis.
Alex Michelson, Fox 11.
Thank you, Governor. First off, nice bookcase. Secondly, I'm wondering, how does this experience for you of quarantining at home maybe change the way you think about this experience that so many Californians have gone through? And a follow-up to the question about the curfew, which I appreciate you asking Dr. Galley a few moments ago. But I talked on Friday with Dr. Birx at the White House about the science behind curfew. She said she didn't want to second guess your decision, but pointed to like Miami, where they did a curfew and they found that it didn't really work because it drove a lot of people to go to house parties, which ended up spreading the virus more. And I'm wondering if you can expand upon the science of the curfew decision and that concern that it might lead to other worse behavior.
No, and I really appreciate that question. I'll ask Dr. Galley answer that more specificity. But you may recall last Monday, I implied my own hesitancy as relates to being open to argument, interested in evidence based upon the studies that have been conducted. And we have the benefit of 3 studies, and some show some very positive behavioral changes, others a little more inconclusive. So I'm very aware of that in the context of this ongoing debate. But we, based upon not only the analysis and review of those studies, but based upon our engagement with our colleagues across this country, health officers across the country, other governors, and their review, based upon all of that, we made the assessment that we wanted to give this a go. Dr. Galley could talk more specifically about his independent analysis, not just the analysis that was conducted in those 3 studies that we were referring to.
Yeah, thank you for the question. And I'll tell you, one of the things that we did, I believe, differently than some other states with a curfew, and remember, we called ours a limited stay at home, because part of the entire approach and concept was not just to ask business sectors to stop operating between those times of 10 and 5 a.m., but also that household gatherings shouldn't occur. So, the guidance isn't just a let's not do it in the businesses, in the restaurants, in the bars, and the other areas, or even outside in the open. And although really difficult to enforce or regulate, the signal and the message is, and don't take these same activities indoors, because that's exactly where spread could occur. So it was meant to complement the other effects of curfews from other areas and enhance it with an additional restriction for the time-limited period of about 4 weeks, 30 days in the purple counties. So it was really that sort of 1-2 punch to try to reduce transmission across our state.
Yeah, and so the bottom line is none of us are ideological about this in the spirit of your question. We are open to argument, interested in evidence. We've committed to a 4-week process based upon the significant increase in transmission rates. We believe in a more targeted and effective strategy than just going back to a full lockdown in the state of California based upon where we are today. And so that was the determination. We're leaning into that, and we will be very cognizant of its cause and effect. And we are very, very open about it, not stubborn about that analysis and review. That said, let me answer the first part of your question. Clearly, anyone that's prone to be with their kids isolated or quarantined for many, many days, it is a very challenging and trying time. And it's certainly something that is now been brought home quite literally in terms of my own experience just over the course of the last couple of days. That said, I have deep empathy and respect for people that don't have the supports of people that are in my position, that don't have the resources of people in my position, and those that are struggling. You can't even imagine being a day away from work or a day or two away from loved ones that need to be in their care. At the same time, we are encouraging them to isolate and quarantine. That's why we have put out many, many different supports over the course of many, many months, either through executive order and or the leadership that demonstrably was exampled by the legislature this year that they provided in terms of providing economic stipends, providing additional supports and protections, legal and otherwise, and why it's absolutely essential that as we move forward, not just as a state, but as a nation, that the federal government wake up and recognize this moment. We can simply no longer wait for a new stimulus. Days are becoming weeks, weeks becoming months. We are at peril at the end of this calendar year, putting people's lives quite literally at risk, the economy in much, much more harm, and families in positions of being much more vulnerable. So all of that is brought in clear, unambiguous focus as it relates to one's personal experience, but also recognizing the experience that millions of Americans have, hundreds of thousands that are struggling in even more dire and difficult circumstances.
John Myers, LA Times.
Thank you. Governor, can you hear me clearly before I begin?
Yes, I can.
Governor, can you hear me?
Yes.
Okay, thank you very much. Just wanted to check because we don't have the ability to do follow-up questions on this. I wanted to know because the beginning of your presentation was muted. We could not hear it. If you talked about what's going on with your family, can you talk about that? And here's what I'd like to have you focus on if you could. If you could tell us what your family knew and when they knew it. Give us a little bit more information about when you knew of information about the CHP officer who had tested positive. Are there additional officers in that team who tested positive? And then also trying to understand the universe that your family operates in. You mentioned that other families are not as fortunate, but could we understand kind of the sense of, for lack of a better term, the pod that your family lives in? Do you have other support people, house cleaners, or child care assistants that help with your children? And are you considering sending the children back to school when they're done, or does this give you second thought, given that one of your children was exposed by a classmate?
Yeah, the school made that decision independently, and they have paused. So that was determined by the school itself. As it relates to my three children that were exposed, it was a CHP officer, and they were exposed. A 4-year-old was exposed first, so forgive me, I don't have the ability to acquire when he knew and how he knew it because of his age, all of them below the age of 11 years old. But when we discovered, or rather we were told of the positive case and the fact that the CHP officer was in close contact with those three kids, we immediately went through the process of protocols and reviews that are well established by the state, and also went to greater lengths to get more specificity about local guidelines as well to make sure that we were abiding by those as well. We chose to wait based upon the review, or rather based upon the recommendation of local health officer. In my case, folks that work on our team, they were required they were encouraged, rather, not required, that we wait 48 hours to be tested because they didn't want a false sense of negative test to come in. And so we tested officially yesterday after we discovered this on Friday. So Friday, waited until Sunday to be tested. Test results came back late on Sunday, came back negative, and we officially started the quarantine clock on Sunday, though it was informal through the weekend. As it relates to the house, I'm blessed because we have many rooms. I'm able to do this without kids jumping on top of me. I'm in an office. I can assure you, it's the first time I've ever had an office. I used a smaller room in an office that was used for many other things in the past. That's a blessing. And I recognize that many people don't even have the ability to do what I'm doing right here. And so that's number one. Number two, no one else is in the household. We have someone that has been with us that comes from overseas. She's been living with us for many, many months. She's part of the pod. That's it. She was tested negative as well.
Jeremy White, Politico.
Thank you so much for taking my question. I would like to first quickly follow up on John's question and get any more detail on when your children came into contact with the infected officer. Was he driving them somewhere, et cetera? And then I hate to be the reporter to the two questions, but it's been a couple weeks now since a judge issued an injunction telling you to no longer alter state law with executive orders. I'm hoping you can tell us about what that injunction, if it is upheld, might mean for your ability to deal with the pandemic through executive action.
Yeah, well, we are appealing that decision, and it will be adjudicated by the appellate court, and we're confident in our legal standing and legal position. It's foundational in terms of governing a state in a time of crisis. It's a profoundly important decision that will ultimately be made through the deliberative process and independent adjudication by the California Court of Appeals, or at least the appellate level, and based upon their jurisdiction. That said, as it relates to the impact, yes, the officer was in close contact with 3 of our kids, not one of our kids, 3 of our kids. And based upon the fact that we're in close contact and they tested positive, when we learned that, we went through a series of protocols that I just laid out and gave to John. And those protocols led to test all family members, including my youngest 4-year-old, which was an episode itself, just trying to encourage 4-year-old to sit and get tested with nasal swab. And fortunately, all of us in the household, currently in this household, all tested negative. We will do subsequent tests, and we will abide by not just state guidelines, but the county guidelines as well. And that quarantine process began this weekend and will continue for 14 days.
Final question, Ashley Zavala, Next Star Media Group.
Hi, Governor. I did want to ask just a couple simple questions about your quarantine. One, how are you feeling? And 2, have you been tested today? I know your communications office said that you'd be tested every day, and I just wanted to see if that test came back negative.
Yeah, no, I've been tested a lot in the last few weeks, on multiple occasions the last few weeks. I feel perfectly healthy. I tested negative yesterday, and I have no expectation that I'll test any differently in subsequent days as we apply by these quarantine protocols. And so we'll let you know as we get these subsequent tests, the extent you're interested. But currently, those last, well, we've never had a positive test. I've been tested many, many times. I was stubborn, you may recall, in the beginning of this pandemic. I did not get tested for many, many months. I made it clear as to why I made that determination, because so many others were not afforded that privilege. I wasn't going to extend it. And now with the availability of much more testing, more widespread testing, and the fact, as you may recall, that I visited prisons, I felt it incumbent upon me at that point to begin the testing protocols. And we've had fairly consistent tests, not just the PCR tests. Those are the ones that are the tests we make public, but also these antigen tests, which I've taken on many occasions as well. I don't have as much confidence, candidly, in those results. Why we always have the backup PCR tests, which are foundational PCR tests, the ones the entire family took yesterday, and PCR tests was what I took previous week as well, and multiple previous occasions. So we'll continue to do all of that and more. We'll continue also to keep you and others informed on what we're doing and where we're going. I want to acknowledge those that may have inquired about where we are on Senate choice picks, that determination has not yet been made, but progress has been made in terms of getting closer to that determination. There's no timeline that we have advanced or considered. Obviously, we'll need to get it done before Vice President-elect Kamala Harris is sworn in as the next Vice President of the United States. But that process continues. We continue to work very, very hard on the budget. Those of you that may have had a question in the queue about the budget, I am very aware, and we've been working overtime, including over the course of this last week in particular, to work to get this budget done, which has to be at least to the printers in the middle of December, cognizant and mindful of the myriad of needs throughout the state of California, but none more important than public health and economic recovery, the needs of our small businessmen and women all up and down the state of California. I said that last week, and I'd be remiss if not repeating that today, and you'll hear me repeat that over and over and over again. I am deeply mindful with 41 counties in these purple restrictive tiers, the impact that's had on small businesses in particular, and all of the uncertainty around a new PPP, distinguished from PPE, as relates to small business supports, which must be a top priority of a new CARES Act, a new stimulus in this country. We're going to do what we can to do more for our small businesses in this state. That is a top priority with the budget team, will be a top priority. I know with the California legislature, based upon the conversations we've had, and I'm grateful that they recognize that imperative as well. So public health, public safety, continue to monitor these counties and the transmission rates in real time. We will maintain our engagement, and not only with you on a consistent basis, but tomorrow, just furtherance of that, Dr. Galley will be updating on the tiered status, and we will likely be making additional announcements through the week and into next week. This virus does not take holidays off, quite the contrary. Take care, everybody, and thank you for tuning in, at least to this rather unusual but increasingly familiar setting here at home. Take care.
Finished rounds in the medical intensive care unit, and we are now seeing about 30 to 40% of our patients with active COVID disease and respiratory failure, many of them on mechanical ventilators and some of them on ECMO to sustain life. I really don't want to see you in that situation. We've had 2 generations of patients in our ICU, a mother and a daughter both die as a result of COVID. I think it's really time to take this seriously and reduce the spread of this disease.